5 subtle itching signs seniors shouldn't ignore. Early detection tips. Did you know that certain types of persistent itching could be your body's way of signaling an underlying health issue? For older adults, especially those over 60, recognizing these subtle signs can be crucial for early detection and peace of mind. If you're finding this information helpful, please consider subscribing to our channel and sharing this video with friends and family. Your support helps us continue providing valuable health insights. Segment 1. Persistent itching on the lower legs. Did you know that a persistent itch on your lower legs could be more than just dry skin? For older adults, especially those over 60, this specific symptom might be an early sign of something more serious, like lymphoma. Lymphoma, a type of blood cancer, can manifest subtly. One such subtle sign is an unrelenting itch on the lower legs, particularly the shins and calves. This itch often lacks a visible rash and doesn't respond to typical moisturizers. It's not uncommon for this itch to intensify at night, disrupting sleep and daily comfort. The underlying cause? As lymphoma develops, it can release certain chemicals into the bloodstream, leading to skin irritation without any external cause. This internal reaction can make the skin feel itchy, even if it appears normal on the surface. Consider the story of George, a 75-year-old man who experienced an incessant itch on his lower legs for 6 months. Initially dismissed as eczema or a reaction to laundry detergent, further medical evaluation revealed swollen lymph nodes and abnormal white blood cell counts, leading to a lymphoma diagnosis. It's essential to differentiate between common skin irritations and potential warning signs. If the itch is persistent, lacks a visible cause, and doesn't improve with standard treatments, it's crucial to consult a healthcare professional. Early detection can make a significant difference in treatment outcomes. Remember, our bodies often send subtle signals when something isn't right. Paying attention to these signs and seeking timely medical advice can lead to early diagnosis and better health outcomes. Segment 2. Itching. Between the shoulder blades. Let us talk about a strange kind of itch. One that shows up between the shoulder blades or high on the upper back, just out of reach. It might seem harmless at first, maybe even annoying, but if it's persistent and doesn't go away with lotions, powders, or new clothing, it could be signaling something much deeper, possibly related to pancreatic or liver health. This type of itch often feels internal, like it's coming from under the skin rather than on the surface. It's commonly misattributed to posture, tight clothing, or just aging. But here's the science. When tumors develop in the pancreas or affect the bile ducts, they can block the normal flow of bile. When bile starts to build up in the bloodstream, it irritates nerve endings, especially in areas rich in nerve fibers, like the upper back. That's why this itch doesn't always look like a rash. There's no redness, no inflammation, just a deep, unrelenting itch that doesn't respond to creams. And it might appear long before other symptoms like jaundice or digestive discomfort start to show. Take Linda, a 70-year-old who noticed this very kind of phantom itch on her back. She tried changing her bed linens, switching soaps, and even adjusting her diet. But the sensation persisted. Eventually, blood work revealed elevated liver enzymes, prompting imaging tests that uncovered a small pancreatic tumor. Her itch had been the first clue, months before pain or other symptoms ever emerged. This isn't to say every back itch means cancer, but when the itch is persistent, internal, and unresponsive to common remedies, it deserves a second look, especially if it's accompanied by signs like fatigue, darker urine, or lighter stools. Those may seem like minor annoyances, but they can be powerful indicators of how your internal systems are functioning. The lesson here: don't ignore what your body is trying to tell you, especially when it keeps sending the same message. A persistent, deep itch on your upper back may be a whisper worth listening to, a sign that something inside is asking for your attention. Segment 3. Itchy scalp without flakes. Now let's move to a place most wouldn't think twice about: the scalp. An itchy scalp often gets blamed on dandruff, weather, or shampoo. But what if none of those apply? No flakes, no redness, and no relief from even the best products. For older adults, especially over 60, persistent itching in the scalp, particularly when it feels like tingling, burning, or crawling, might be an early flag from the body. This sensation can be tied to changes in the immune system, especially with blood-related conditions like leukemia. As abnormal cells begin to multiply, they can disrupt your body's inflammatory responses. And one surprising way this shows up, through nerve irritation just beneath the skin, particularly in nerve-dense areas like the scalp. There is also the possibility of skin cancer forming on areas of the scalp that are more exposed due to thinning hair. These cancers often begin quietly, with nothing more than a small patch of itchy skin that never seems to heal or move. Consider Henry, 73, who ignored his scalp itching for months, assuming it was dryness. But blood work revealed elevated white blood cells, and a later diagnosis showed early-stage leukemia. His only symptom had been that stubborn, restless itch. So, if your scalp has been persistently itchy and no remedy seems to help, don't brush it off, especially if it's paired with fatigue, bruising, or a general feeling that something is off. Sometimes, the smallest, most constant signs carry the biggest warnings. Segment 4. Itching on the chest or breast area. As we grow older, one of the most difficult changes to face is an T in the body, it-S in how others see us. After 80, many seniors begin to feel invisible. You might notice it at the grocery store, when the cashier talks past you, or at the doctor's office, when your questions are answered indirectly. It's not usually meant to be unkind. It's simply how a fast-paced world forgets the value of slow wisdom. But your presence still matters. You've lived decades, shaped lives, weathered storms. Being overlooked doesn't erase your worth. That quiet fading is only permanent if you let it be. You have the right to speak up, to share your thoughts, to ask questions, and to expect to be heard. Reclaiming your space means participating with purpose. Join a community group, share your story, volunteer. Even small acts like introducing yourself or making eye contact remind others, and yourself, that you're still here and your voice still matters. Segment 5. Persistent itching in the anal or genital area. Persistent itching in the genital or anal area is a sensitive issue. One many older adults ignore out of discomfort, but if the itch doesn't go away with hygiene, creams, or lifestyle changes, it could be more than a minor irritation. In some cases, it may signal early signs of cancers like vulvar, anal, or penile cancer. This itch often feels deeper, more raw or burning, and it lingers, especially at night. It's easy to dismiss it as aging skin, a reaction to clothing or dryness. But when it keeps returning, always in the same spot, it deserves medical attention. There's no need for alarm, only awareness. Let your doctor examine the area. Catching potential issues early, even uncomfortable ones, can make all the difference. Don't let embarrassment stop you. Your body's signals matter, and being proactive is a sign of strength, not weakness. Closing thoughts. Aging doesn't silence the body, it simply changes the way it speaks. It may no longer shout through sudden symptoms, but instead whisper through small signs like a stubborn itch. These signals aren't meant to frighten you. They're reminders to pay closer attention. As we've seen, areas like the legs, back, scalp, chest, and genital region can quietly reveal deeper health shifts. You don't need to panic. You don't need to assume the worst. But what you do need is awareness. If something feels off, persists, or doesn't respond to your usual remedies, it's worth a conversation with your doctor. Sometimes, the smallest signs are the earliest lifelines. If today's insights helped you see your health in a new light, we'd love to hear from you. Leave a comment below and share what resonated with you most. Don't forget to like this video and subscribe for more valuable guidance on aging wisely and living fully. You are not alone. Your voice, your story, and your well-being matter.